Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. The information that is provided in this program is to assist you in exploring all available options, to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. The information should please not be substituted for the diagnosis and treatment of any medical condition. And also, please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. So, in this recording, we will be looking at the impact of birth practices. So, why do we need to inform ourselves about the impact of birth practices? Now, supportive practices during childbirth and mother baby bonding practices can affect the duration and the success of breastfeeding. Now, although inappropriate maternity care cannot be held solely responsible for low exclusive breastfeeding rates, appropriate care may be required as a prior condition for raising breastfeeding rates. And until practices improve, attempts to promote breastfeeding outside the health services may be hampered. After all, well begun is half done, meaning by beginning something in the best possible manner, it will take less effort to accomplish it. Now, I have said this before in a previous recording that normal, natural birth sets the stage for problem free breastfeeding, what nature intended, while a complicated intervention intensive labor and birth sets the stage for problems. So get help sooner than later if you know you are not going to have a normal birth. And remember, nature wants us to succeed. Lactation is not as fragile as many people think, otherwise, the human race would never have survived. Now, babies who experience the stress of labor have been shown to have improved lung compliance. So the lung's ability to stretch and expand is better. And the absorption of lung liquid is better. Remember, in the womb, the baby is a little water creature. Also, in response to the stress of labor, there's an increase in stress hormones in the baby, which leads to an increase of blood flow to vital organs, which means the baby's heart and brain is better protected. Brown fat stores, which is healthy fat babies are born with, located on their backs along the upper half of the spine towards the shoulders. Well, anyway, this brown fat in baby's body is metabolized for fuel, which is important for heat production, which means the newborn is better able to withstand changes in temperature after birth. So, a baby who experiences stress of labor also have dilated pupils, and they are more alert, which are both important for immediate bonding. Also, a baby who experiences the stress of labor has an improved immune response, partly because the stress hormones of labor are involved in the activation of the baby's immune system. And there are many more benefits of being born vaginally. So let's just look at some of the things that could help or hinder an optimal start in exclusive breastfeeding. Now, you can see the effect of labor intervention on breastfeeding and milk supply in this flow chart, and you can pause the recording if you want to study it more closely. Now, some labor and birth practice which can help the mother and baby get a good start with breastfeeding include birth practices such as having a skilled attendant, minimal use of labor interventions, and these include artificial rupturing of membranes. This is also called a surgical induction to speed up labor. Routine episiotomies. It's going to make the mother very uncomfortable. Um, Vaginal examinations, assisted births with vacuum or forceps could have an effect on the baby's ability to feed, breastfeed after birth, pain relief medication, IV fluids, etc. All of these each have their own uh, kind of effect on the ability to breastfeed or on the comfort of breastfeeding. Also, being mobile and upright. This is going to add to the mother's comfort and assist in energy conservation, which can have an effect on her and her baby's ability to initiate breastfeeding after birth. And then support during labor and birth from a birth companion of the mother's choice. Could be the baby's father, maybe a mother or sister or a doula. um, who stays with the mother throughout labor and birth. And this is actually one of the most important factors contributing to a smooth birth and an easier start in breastfeeding. Now, just a quick note on having a birth companion. This is research based. Having a companion can reduce the perception of severe pain. It can encourage the mother's mobility. It can reduce the mother's stress, speed up labor and birth, reduce the need for medical interventions, increase the mother's confidence in her body and her abilities. And this support results in increased alertness of the baby because less pain relief drugs reaches the baby because the mother is using less drugs. There's a reduced risk of the baby having cold stress and low blood sugars, early and frequent breastfeeding, and another thing the support can result in is easier bonding with the baby. Okay, so another birth practice that can help the mother and baby get a good start with breastfeeding is consuming light food and fluid during labor. Now, labor is hard work, and women need energy to do this work. And the desire to eat and drink varies from one woman to another, but she should be allowed to decide if she wants to eat and drink. And there's really no evidence that withholding light food and drink from a low risk woman in labor is beneficial as a routine practice. So, a mother's fatigue and dehydration can have an impact on her ability to initiate breastfeeding. But consuming light food and fluids during labor will help prevent this. Another birth practice which can help a mother and baby get a good start with breastfeeding is the use of non medication methods of pain relief, like labor support, encouraging walking and movement, providing a massage, holding hands, cool cloths, warm water, positive words, verbal reassurance, a quiet environment, no bright lights, labor position of the mother's choice. All of these will have a positive effect on the baby's alertness and ability to breastfeed. And another helpful birth practice after birth is keeping the mother and baby skin to skin after birth, not swaddling the baby, because babies can't use their reflexes and movements to begin breastfeeding within the first hour if they are tightly wrapped. And then also keeping the mother and baby together day and night, and we'll talk more about this in a future recording. And Lactation also says that the mother and baby needs to be together early and often to establish a satisfying breastfeeding relationship and a reliable milk production. Now, to help you be in control of what happens to you and your family and to take part in any medical decision making assertively, not passively or aggressively, without having to know all there is to know about the human body, use these 7 informed consent questions. I just use the acronym BRAWN. So you can ask your caregiver, is this an emergency or do we have time to talk? Ask, what would be the benefits of doing this? What would be the risks? If we do this, what other procedures or treatment might we end up needing as a result? What alternatives could we try first or instead? What would happen if we waited an hour or two before doing it? What would happen if we did nothing at all? Um, yeah, so these are your 7 informed consent questions, and use these questions in future when going to the doctor for yourself or any family member. Okay, thank you for watching this recording. In the next recording, we will be looking at early days, things that can help breastfeeding. So please visit the breastfeeding clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and also receive the class notes. And you can navigate the class recordings easier from the website. And feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.